Did you know pressure injuries have been a recognized disease entity for thousands of years and have been found on mummies up to 5,000 years old? Today, I would like to discuss with you hospital-acquired pressure injuries, or HAPIes for short. As a critical care nurse, it is my responsibility to be educated on these pressure injuries, prevent these injuries from happening, and educate my patients and discuss these with coworkers. Some of the information in this discussion come from an article wrote by Karan Agwal and Neha Chauhan titled Pressure Ulcers, Back to Basics. It was published in May of 2013 in the Indian Journal of Plastic Surgery. Pressure injuries, as defined by the National Ulcer Advisory Panel, or NPUAP for short, is an injury to the skin or underlying tissue, usually over a bony premises, as a result of pressure. This can also be in combination with friction or shearing. It can lead to ischemia and cell death. In the past, these injuries have also been called pressure sores, pressure ulcers, bed sores, ischemic ulcers, and decubitus ulcers. And while these terms may imply that only bed-bound or non-ambulatory patients can develop these sores, the authors would like to note that it is important to realize that any people, ambulatory or non-ambulatory, can develop these ulcers, noting that anyone who has a reduction in mobility is at major risk for developing a pressure injury. In most cases, these pressure injuries can be preventable. However, the presence of the injuries is a continuous problem in the healthcare facilities. The authors explain pressure injuries are one of the most costly and physically debilitating complications of the 20th century, following third behind cancer and cardiovascular disease. Pressure injuries cause considerable harm to the patients, hindering recovery, increasing pain, and hospital stays. They can also be associated with such infections such as sepsis, leading to mortality. So how can we prevent these injuries? In order to prevent these injuries, we as the nurses need to implement two basic steps into our nursing process. The first one is assessing patients that are at risk, and the second one is implementing interventions for these patients. Agwal and Chauhan give many great assessment tools in their article. The one that I found most interesting was the Braden, which is one I use in my facility. They also list many interventions that can be used for these patients to help prevent this from happening. Some examples of those are use of barrier creams and turning the patient every 1 to 2 hours. The use of the assessment tools and interventions should be used on all people with reduced mobility. The authors of this article do not go into a lengthy discussion on the management of pressure ulcers, as they believe prevention is better than the cure. Due to the history of HAPIes, along with the risk factors associated with HAPIes, it is obvious they are not going to go away anytime soon. And we as nurses need to do our part in preventing these pressure injuries from forming.